Welcome to Podcast, the Business of Dentistry podcast, brought to you by Practice Plan. Podcast delivers the best business advice, real-life stories, and practical hints and tips to make your practice a more profitable and sustainable business. And now, here's your host.
Hi, my name's Fern Jackson. I'm from marketing at Practice Plan, and today I'm really excited to be joined with Nina Farmer. Hi, Nina.
Hello, thank you for having me.
Oh, no worries. Thank you so much for joining us. I'm going to let you introduce yourself to the listeners and just tell us what exactly you do in dentistry.
Yeah, so as I said, my name is Nina Farmer. I am a dental therapist. I've been a dental therapist now for 12 years this year. And I'm also dual trained as a nutritional therapist as well. And I trained as a nutritional therapist in 2019 is when I qualified. I love bringing both of those skills and qualifications together.
Yeah, definitely. And how did you sort of get into dentistry and then sort of start with the nutrition role as well?
Well, I was a dental nurse to start with, so I've been in dentistry for over 20 years now, which makes me feel very old when I say that out loud. But I always wanted my own patients. I loved it so much. I always loved, treating those nervous patients and holding their hand. And I knew that one day I'd have to have patients of my own. So I went off to do dental therapy for that reason. And along the way, I had this real interest in holistic and whole body approach. I had some problems with my own hormonal health as well. And it was really tough actually to get any answers from anybody. And I felt really out of control. So I thought, what better way to go and get back in control was to go and learn about how the body works, how we can, provide nutrients for it to help it and to understand it a bit better. And I also then was thinking, well, it'd be really nice to help my patients to feel that way as well. So it was like a double-edged sword really as to why I did it.
Amazing. And yeah, like you said, I think a lot of people do struggle with the sort of hormonal side of things. So it's such a interesting topic. So I suppose then it's a bit of a broad question, but how does nutrition really affect our overall health?
It is I could talk all day, couldn't I, on that? But I think the one thing that I really think about when I talk about, especially with our dental patients, is, the host response and how we can boost that by, providing nutrients to support inflammatory processes, the immune system. Every cell in the body needs the nutrients, vitamins and minerals in order to provide its functions. We need protein to make antibodies. So you can soon see that if someone isn't getting the right nutrients or, eating enough protein, then they're not going to be supporting these processes. And there's enough research out there now, if you went onto the internet and Googled it, to show that anyone who's malnourished and hasn't got these nutrients is going to be compromised in regards to healing, and being more risk of and susceptible to infections.
Yeah, and when you're talking to your patients, then do you find that there's common deficiencies in our nutrition, or are there things that keep cropping up, or are they all different?
The one I see the most actually is B vitamins. Now, B vitamin is it's well known as the stress vitamin, but also supports sort of energy production as well. Okay. So it's no wonder that I see a lot of that because, everyone's very stressed and tired, aren't they? Yeah. But that can sometimes manifest as sort of cracks in the corner of the mouth, or on the tongue. So we know it's angular colitis. So there are other reasons for it, of course, as well. And we do have to use that kind of inner detective in us. If we have got someone who's highly stressed and tired, and they perhaps aren't a denture wearer and they're not got that saliva pooling, maybe perhaps it is a B vitamin. Or B vitamins as well are synthesized and absorbed in our gut with the small intestine. So, right. If we've got these patients who are telling us in their medical history they've got some gut issues as well, it kind of builds that picture. But yeah, B vitamins is the one I see the most. But I do also see sort of low iron, low magnesium, vitamin C. And patients love it when they come in and you start talking to about it, because they feel like you really care about it and you have that real connection with them. And sometimes they say, wow, I thought I was just coming to have my teeth looked at, but you've changed my life.
Yeah, that's amazing. And so what kind of things can you get the B vitamins from then? What sort of nutrition?
Yeah, so it's in most of the foods that we eat. So, in our beans, our nuts, our seeds, and our vegetables that we eat. But for people who are highly stressed and tired, their additional need goes up. So they're using up more of that nutrient. So, it might be that for some people they need a bit more of a therapeutic dose with a supplement, but I would never recommend doing that unless you were obviously looking at the cause, because if they've got a gut issue, then really if you're taking a supplement, you're not going to be absorbing it. So I would always say to patients to, you know, signpost them to someone who's nutritionally trained, or to maybe their GP if they've got some gut issues,
Yeah.
you know, to look at that.
Yeah, no, so interesting. And what preventative measures then do you recommend to your patients for sort of maintaining that good oral health?
So it's a good question. So whenever I have my patients come in, I obviously do a plaque first perspective, because that's what we're taught to do, isn't it? You know, sometimes it can take several appointments before I'll even talk to patients about nutrition. It depends on where they are motivation wise, and how much work they need in order for plaque control. So, you know, sometimes for a patient, it'll be the toothbrushing and the incidental cleaning, and whereas sometimes someone will come in and they want to go the whole hog, and we'll talk about, you know, the nutrients that they need as well.
Okay, interesting. And so do you have your dental patients then, and then do you have nutritional patients as well?
I do,
Exactly.
yes, I have
Brilliant.
two. I do see nutritional patients as well, but then with regards to my dental patients, I just give that bit more in my appointments as well, because, you know, I've got that knowledge there, and if I see something, I don't know if you've heard of, it's the incentive from the NHS called Making Every Contact Count, but it's about people who have this exposure to patients regularly. You know, we can see change in our patients, and we can make that contact count because it is something that we do notice, and they trust us. We can have those conversations and obviously help them. And if we don't have the full knowledge, pointing them in the right direction.
Yeah. No, I think that's brilliant. And I guess is it quite rare to have a dental therapist that can advise on nutrition as well? Or
Well, I think there seems to be a lot more of us now. So, and people are coming to look at this because it's becoming quite well known, the whole body approach, isn't it? And the
yeah,
link. So
yeah,
yeah, I think it's quite an exciting time for us, because it's, you know, for me, it helps me to feel really fulfilled in my work as well.
yeah, definitely. And when you say you see a lot of people with common deficiencies, does it all come down to the nutrition, or are there external factors that can help that as well?
Yeah, I mean, it's what's going into their bodies. There's
Yeah.
research to show that when we're stressed, we use up so much more of our nutrients because our body's using it up. You know, things like alcohol intake, smoking. Smoking, you need 35 more milligrams of vitamin C a day in order to be able to counteract the antioxidant activity in that. So, you know,
Really? Oh
yeah.
my
So there's
gosh.
so many different variables. You know, how much people are sleeping. Also, as well, some of the foods that we can eat can be like pro-inflammatory. So, like some of these fats that we have in processed foods as well. So that it is sort of looking at the bigger picture, and there's
Yeah.
only so much we can do in a 30-minute sort of
Yeah.
hygiene appointment. But for me, it's about, you know, the thing that is most obvious and most impactful. And obviously, if I don't know or I can't do it, then signposting.
Yeah, definitely. So to finish then, what are some quick wins or some, simple dietary changes that people can, start to implement to improve their overall health?
So first one I always recommend is 30 to 40 fruits or vegetables a week. And I always say a week, not a day, because if you have a bad day, you can catch up and it's kind of positive.
Okay. Yeah.
So if you have that, you're going to be getting the vitamins and minerals you need, the antioxidants, which is going to help healing and tissue growth, fiber, you know, for our gut health as well, keep our gut moving along, but also feed that gut bacteria.
Yeah.
Protein, so making sure that we know how much protein we have, because I think a lot of people don't realize how much we need to have. So we need a minimum of 0.8 grams per kilo of body weight of protein, and that's for someone who's sedentary. So if you're a bit more active, it needs to be 1.2 grams per kilo of body weight as well. So, you know, if you've got patients that are in the process of healing, particularly from periodontal disease, by upping their protein status, that's going to really help them heal.
Yeah.
And another thing is just hydration, you know, drinking plenty of water, because I think we all can be a bit guilty of it sometimes, can't we? And you know, every cell, tissue, organ in the body needs it in order to survive.
Amazing. Yeah. And they do sound simple, don't they? But actually, when you think about it, are we eating 30 to 40 fruits and veg a week? I'm probably not. So it's but I like the thing of not putting the pressure on the 5 a day.
Yeah, I think so, because then you don't sort of think, oh, I've not done it today, and then it's a negative feeling, isn't it? So
Yeah.
making it a weekly commitment.
Yeah. And what are your thoughts on like taking supplements and things, or do you think really it should come from our nutrition?
It should always be a food first perspective, but sometimes there are additional needs. So, for example, vitamin D is a really common one. But the thing is, we have to be really careful when we're recommending supplements and taking them, because some of them we store in our body. And if we don't know our baseline, we can have too much of a good thing as well. So I would always say taking advice is really important on that. I'm quite confident with supplementation because of my qualification. But I would be, so for example, as well, you know, iron for someone who isn't menstruating can be, you shouldn't really take that because you can have too much of it in your body as well. So it's little things like that. It's about learning, you know, what is safe supplementation. So yeah, food first perspective, and then if there's additional need, for example, like with the gut and the B vitamins, you know, my tutor always used to say to me in nutrition when I was learning nutrition that you're just giving them expensive urine because they're not absorbing it, because if there's an absorption issue. So, you know, if we want to be really helping them, then sometimes signposting is the way to do it.
Yeah. Oh, brilliant. Well, thank you so much for sharing that. I feel like there's so much more we could talk about in depth, but I know we haven't got much time today, but hopefully we'll catch up again soon. And thank you for sharing that info. If anyone would like to hear more or get in touch with you, how would they do that?
So I've got an Instagram page, so it's Nina at Integrated Health, or my email, which I'm more than happy for you to share, is Nina at integratedhealth.me.
Lovely, and we'll put the details in the copy below if anybody'd like to find out more. But thank you so much, Nina, for sharing your expertise today.
Well, thank you for having me.